Nursing is the largest healthcare profession in the US, with a variety of different types of specialty. Nursing contains autonomous and collaborative care for people of all ages, families, groups and communities, sick or well, and in all settings. We are going to focus on one specialty area, medical surgical nursing, sometimes called adult health nursing, which is practiced in many settings such as acute care agencies, skilled nursing facilities, ambulatory care clinics, assisted living facilities, and home patients. Medical surgical nursing is a nursing specialty area concerned with the care of adult patients with diverse medical issues. Medical surgical nurses take care of patients either preparing for or recovering from a surgical procedure.
What does a med surgical nurse do? Med surgical nurses are trained to assist a variety of patients, so they specialize in working in multiple health settings such as hospitals, where they work as part of a team with other healthcare providers. In clinics, medical surgical nurses conduct physical exams, as well in nursing homes and surgical centers. The experience medical surgical nursing offers. Medical surgical nursing is the backbone of healthcare. It offers an excellent experience for all nurses who want to decide their specialization because they get to work with various patients who suffer from different health problems. As a result, they are training to help in many different settings of healthcare.
What is a med-surg unit? A medical surgical unit provides care to adults with different conditions and illnesses. A traditional med-surg unit can be found in hospitals where caregivers give all patients adequate care. In this unit, nurses often work in a more fast-paced conditions than other nurses. This is because of the high volume of patients and all the intense work they need to do. What kind of patients are on a med-surg unit? This unit usually has all kinds of patients with different illnesses. Some examples are traumatic brain injury, hip or knee replacements, amputations, infections, sepsis, diabetes, cardiac or mental health patients.
The pros and cons of being a nurse in the med-surg unit are med-surg nurses often work in a more fast-paced environment than other types of nurse due to high volume of patients. According to United Nurses Association of California, as of January 2008, the ratio of nurse to patient for med-surg is 1 nurse is to 5 patients, compared to a step-down nurse who is 1 nurse is to 3 patients. But working in this unit, your knowledge and experience will serve as a solid foundation to better prepare you as a nurse if you want to transfer to a different nursing specialty later on.
Becoming a medical surgical nurse can be a lengthy process. First, an applicant must complete an associate's degree in nursing, an ADN, or a bachelor's of science in nursing, a BSN. After obtaining either degree, a nurse will not have a challenge finding a job in this particular field, mostly because hospitals are quick to employ newly registered nurses right out of college. After being in this specialty for about 2 years, a nurse can take the Certified Medical Surgical Registered Nurse exam, or the CMSRN exam, and after that is taken, a nurse will have their certification to become a medical surgical nurse.
The Bay Area is the highest paying city for nurses as of May 2020, according to the U.S. Bureau of Labor Statistics. One of the hospitals in the East Bay offers $62 per hour as a starting salary. But one of the qualifications on most of the hospitals in the Bay Area is a BSN graduate and a clinical nurse 2 or RN2. What that means is, depending on the facility policy, some offer clinical ladder based on years of experience, education, and certifications. A clinical nurse 1 is a new graduate nurse, and a clinical nurse 2 is usually a nurse who has at least a year of experience or 2,000 hours nursing experience at a hospital setting facility.
The average salary for a registered nurse in the medical surgical specialty is about $86,567 a year, ranging from $46,000 to as much as $134,000 in some areas. The main reason for this difference is because of the cost of living throughout the United States. If you look to the map on the right, you will see that there are different numbers that represent the cost of living index between states. States with a higher cost of living index have a higher average salary for medical surgical nurses.
If you're not sure what you want to do after you graduate as a nurse, then medical surgical nurse is probably better for you. In medical surgical nursing, you get a variety of patients. You'll be amazed at how diverse a patient care is in this unit because you get a little bit of every medical condition you can think of. Time goes by so fast when you work in this unit because it is a fast-paced environment and there is no downtime. Not only surgical patients are in this unit, but people with certain conditions like infections, diabetes, hypertension, cardiovascular disease, respiratory illness, dialysis patients, and also psychiatric patients with complications. As a new graduate nurse in this unit, you can build a strong and solid foundation because you see so much and you learn so much and you become a better nurse. To sum up, if you are hoping to gain professional growth while deciding to go to another field of nursing, this is the ideal job for you.